Hi, I'm Jerry Hesch. I work at Hesch Institute in Aurora, Colorado, and I treat pain throughout the body. This presentation is on how to prevent low back pain when handling luggage and sitting on airplanes. We'll start talking about luggage because you have to take the luggage out of your house into the car and get down to the airport and then offload it. So luggage can be pretty heavy. They allow 50 pounds, and it's ideal to use both handles. And hopefully your luggage has wheels, and even better than the old straight wheels would be the spinners, okay? And of course the expandable handle is really good, okay? So when you're ready to get it into your car or your truck, whatever, I have a truck, so you want to take advantage of both handles. So truck bed is here, and so I want to be pretty close between this and the truck bed, okay? Now I'm going to take advantage of the tailgate. Once I lift this up, I'm going to lean it against the tailgate, and that will definitely reduce stress on my low back, okay? Now there's a little secret. When you pick up something heavy, if you test the weight and then immediately pick it up, your nervous system is wiser than our conscious mind. It knows how much muscle power you need to generate to safely pick up that item. So wide stance, feet are wide. Okay, you're very close between the weight and where you're going to put the luggage. And you just make sure you bend knees with back, okay? And then two handles, come and prop it against if you're putting it in a truck, and then slide it up. Okay, and then you want to spin it around so the handle is facing you so that when you get to the airport it's easy to pull out. Same thing applies to a vehicle if you're putting it in the back of it. Okay, in my truck I have a 6-foot pole and I have a hook that I use duct tape on the end of it. So when I get to the airport, if the luggage shifted all the way to the front of the bed of the truck, then I use that pole with a hook, and then I just slide it to me, okay? Now my wife's vehicle is a medium-sized SUV, and so we load it in the back of the SUV, and if it shifted forward against the back seat, you know, if I bend over like this and try to pull it, that is a lot of stress on my back. There is a secret, okay? Imagine this is the back of her car, and this is the bumper, all right? So what you do is, feet are wide, and you lean into the bumper, or the back of the vehicle, whatever you call that part, and then you just bend forward and slide it to you, okay? Again, using both handles, and take advantage of that edge of the car and let it slide down to the ground rather than pick it up and then set it down, okay? So now we're gonna talk about when you're at the airport and the luggage is coming down the turnstile. And I think, you know, we're in a hurry and we're not paying attention. And I think a lot of people hurt their backs slogging that luggage off that turnstile. And they may not feel the pain for a few days, or maybe something else happens, but they're already vulnerable because they may have stressed it at the airport. Be a nice research study, right? So when the luggage is coming around the turnstile, you want to manipulate it so that you can easily access both handles. Okay, so as it comes down, manipulate the luggage as you need to, and you may have to then scoot on down and then prep yourself to pick up the luggage. You should try not to do anything in a hurried fashion. okay? And that rail on the turnstile or the edge of it, take advantage of it. So we'll pretend that this chair is the edge. And so I come and I bend my knees and I bend my spine and I pick up with both handles, slide it on top of that rail, take advantage of it. And then when you're ready to set it off that rail onto the floor, just keep sliding it down, okay? So that can be very helpful. And so what we're going to do now is talk about sitting. And I've been passionate about sitting since I first went to college. Due to a motorcycle wreck, I didn't like sitting at all, and even my upper body didn't like it. And in physical therapy school, we had to do a senior project. And I chose to do one on sitting comfort. And my classmates and teachers kind of wondered, well, what does that have to do with physical therapy? And I said, well, people sit. And if they have back pain, sitting is not comfortable. And you have increased discal pressures based on Nachemsen's study, 1970, on discal pressures and blah, blah, blah. And for me, I was more comfortable when I paid attention to the ergonomics of sitting and the height of the desk and all of that good stuff. And so I would drive down into Mexico State University in Las Cruces I was going to UNM Physical Therapy School in Albuquerque, because they had a journal in ergonomics. UNM, University of New Mexico in Albuquerque, had another journal, and I did a study on using a slanted foam on the chair that tapers from the back downward. So it's about 3 inches tall on the back, tapered to 0. At that time, those were not on the market. I'm quite sure I was the first person to make that and put it on the market. A lot of the literature came out of the Scandinavian countries on sitting, really good data. And so I made those and I sold those in Albuquerque, but got out of that because I wanted to be a clinician, not be in soft goods. Anyway, so I never made a lot of money on that at all. Too bad. Well, too bad. But what you can do, depending on your height, it is ideal to have your hips and knees either level, but not knees higher than hips. And a couple of things that you can do. You can sit on a book. That's what I did when I was in college. I'd sit on books. You can use a gardener's kneel pad, okay, and take it on the airplane. And that, for me, you can see that it raised my hips higher than my knees, and it puts my pelvis in a more neutral posture. So it's really easy for me to move my pelvis, and it in turn moves my low back, okay? Or you can go cheap. You know, when you get something in a big box, it's got this nice 1-inch foam. Perfect. This was free, okay, with the shipping in a box. And you can cut it with a bread knife to fit, okay? I will interject that if you have tailbone pain, you can shift the foam or the gardener's kneel pad forward, and so you're weight bearing differently, and it takes some getting used to. You'll have to acclimate to it, so you may not tolerate it for the full flight, but maybe a half hour sitting this way, unweighing the tailbone, okay? So it's in front of my sit bones, so you can see I'm not weight bearing on my sit bones, and there's my tailbone, and I'm certainly not weight bearing on my tailbone either, okay? When I travel a distance, you know, more than say an hour away, then I will set my phone for every 45 minutes. Then I do some simple exercises. But before I talk about that, let me just say that you can also buy, this is a standing pad from Home Depot, but they also sell a half size as a gardener's kneeler. And if it's too big, you can trim it with a bread knife. And the gardener's kneel pad at Home Depot is only $15, and it is very good foam. So that's what I recommend. I've seen the gardener's kneel pad because they're covered, well, they have a design, right, dipped in rubber to cover it, and so they're more like 20 bucks or 29 even. Alrighty? Okay. Now, in your airplane seat or at the airport while you're sitting waiting, you can take a gallon Ziploc bag. I take 2 of them, and if you ever have an incident of back pain, you can fill it a third way with ice, take the air out of it, zip it closed, and then put it in the other bag in case you get a tear, and then you can use that. Lean against your back for 10 minutes, maybe every couple of hours or so. But the dry one I use to sit on. And it reduces the friction of the cloth seat. And I'll tell you why in a minute. You could sit on a magazine. You could pick up that plastic embossed instruction sheet, or the one that tells you what drinks you can order on the airplane, and that reduces the friction as well. And the concept is that every 45 minutes your phone reminds you, and you get up and you walk the length of the airplane, okay? And then when you sit down, you want to do some very simple movement. And the first one is I roll my pelvis back and forth, okay? Nobody knows I'm doing it. It's a small movement, but a very good movement, a very therapeutic movement. And you can certainly do more than 10, but I would at least advise a minimum of 10, okay? The next exercises is shifting your weight by lifting one sit bone and then the other, side to side. So I'm exaggerating the movement, but if I was on the airplane doing it, you wouldn't even know I'm doing it. I'm doing it right now, and I'm not distracting anybody or, making it real obvious. The next movement that I do is the pelvis stays still. And all I'm doing is twisting my shoulders left and right. Okay? But even a small amount of movement can be very therapeutic. So this is the amount of movement that I induce when I do it, and I feel it all the way down my spine. Okay? And the next one is I piston one knee forward and the other one back, and then I reverse that. So can you see that movement? Okay? And you can do it very small. Now I'm doing it very small movement. I feel my pelvis moving. I feel my hips moving. Perhaps my sacroiliac, my pelvis, and my low back is moving as well. So those are really nice exercises that you can do to help you survive the challenges of travel. And I'm trying to think if there's anything else that I should mention. I will just add one more piece. When you go from sitting to standing, I learned this in physical therapy school. And the lesson was mostly for the elderly that may have weak quad muscles, other weak muscles in their lower extremities. And if you just get your upper body weight forward, then the process of standing is much easier. Stu McGill has done some nice work on that. You could search him out, STU. McGill, he's up in Canada. And others have spoken on it, and you can find lots on YouTube and other social media platforms describing it. But basically, I encourage people to bend right here. So I tell them, your spine is a solid piece of wood, okay? The bending is down here, okay? And what you want to do is get your nose over toes, okay? Anatomically, I have less motion, so I'm not quite nose over toes. But the concept is nose towards toes, and then standing up is so easy, okay? And They can also use their hands to push up if they need to. And it's good for people to practice this movement, okay? It's called hip hinging, all right? And just have your clients practice that if you're a clinician, and if you're the person with back pain, just practice this kind of movement, especially when you get up and down from a chair. And lastly, I want to add one more thing. Driving cars can be hard on hips and on the low back, and sometimes we're in a hurry to get where we're going, and then we lose our body awareness, and then it's easy to get in trouble. Okay, when I'm carrying something in my truck, if it weighs more than 3 pounds, or if it's bulky, okay, I go to the passenger side, open the door, set it down, close the door, and then go get on the driver's side. What I don't want to do is really twist myself carrying it as I enter the truck and twisting to the right with something that's a little bit heavy, because weight times distance equals torque, and it's more stress than if I had, say, 5 pounds on my head. Okay, force times distance can contribute to injuries. So that's one more thing. And then lastly, if you're getting into an SUV or a truck and there's a loop that you can hold on to, that's helpful. It's very helpful to just slow it down. Don't be in a hurry. And if it's a sedan and the steering wheel is right here, okay, I open the door, okay, turn around, okay, and I sit, and I bring my right leg 45 degrees to the right. I catch up with the left. I do it again, and I catch up, okay? So that's gonna add 2 seconds to my outbound trip. When I arrive, getting out the same way is gonna add 2 seconds, but my back will thank me for it, okay? So getting out, halfway out, halfway out, halfway out, halfway out, lean forward, nose towards toes, and that's it. So I hope this is helpful to you. Safe travels to you, and take care.